Let me, on behalf of the National Executive of EMSON and the fantastic local organizing committee, welcome you to our 46th annual general meeting and scientific conference. We are kicking off proper. Alongside with me today is Dr. Chinye Patrick Nwayawuchi. Welcome to Lagos.
Thank you very much.
Excellent. Yes, so we want to appeal that there's going to be a little modification with our usual plan on the program. Our keynote speaker is on his way out of the country, and for that reason, we would like to bring him on now. And after he finishes his keynote lecture, then we will follow the normal format for the presentation. This is because of the love he has for the association. He's actually at the airport right now, and he will be boarding very soon. So on that note, I would like to introduce our keynote speaker, Dr. Bolanle. Can you just do one or two lines about the citation for him? One or two lines because he's about to board.
So good morning, everyone, and good morning, my very senior colleagues, and everyone. I'll be presenting the keynote speaker's citation, Professor Adamu Bakari, MBBS, MSc, FWACP, FACP, FACE, FEMSN, FIMC, Chief Medical Director, CEO, Adamu University Teaching Hospital, Yola. Professor Bakari was born at Guri Town of Green Local Government, Adawa State, on the 26th of March, 1966. He attended the Guri 1 Primary School from 1972 to 1978, Government Secondary School from 1978 to 1983. Professor Bakari has a specialist training in internal medicine and endocrinology at the Ahmadu Bello University Teaching Hospital, Zaria, after which he joined the services of the Ahmadu Bello University Teaching Hospital in 2002 as a lecturer 1 and now a consultant. He rose through the rank and was promoted to the rank of a professor of medicine in 2011. Prof holds the fellowship of the West African College of Physicians, Fellowship of American College of Physicians, Fellowship of American College of Endocrinology, Fellowship of Endocrinology and Metabolism Society of Nigeria, as well as the Fellowship of the Institute of Management of Consultants. He holds the MSc degree in Biomedical Education from University of Ibadan in 2011. So Professor Bakari is widely traveled, is happily married, and is blessed with 12 children. We welcome Professor Bakari to please take his keynote lecture. Thank you.
The chairman of this occasion, our president, my distinguished very senior colleagues and colleagues. Let me start by thanking you most sincerely for the opportunity to be the keynote speaker of our AGSM this year. Let me start by apologizing that I ought to have been there physically, and that was my actual plan. As you can see, I'm now in transit, and I feel I should still deliver it online. Let me thank the organizers for making this possible for me to be able to present it virtually. Speech is Endocrinology in Nigeria, Advancing Care Amidst Brain Drain. Next slide, please. As we all know, endocrinology is the chronologic disorders, especially diabetes, are on the increase all over, and Nigeria is not an exception. Of course, the incidences and prevalences ranges between urban and rural areas. We have areas where we have as high as 10%, and we have areas that are around 2 to 3%. This means there will be need for many more endocrinologists to address these issues. Unfortunately, there are very few endocrinologists in Nigeria, but the data on the actual number is difficult to ascertain. Anecdotal evidence suggests that there are less than 200 who are currently practicing in the country. If you transpose that to about 100 tertiary hospitals which belong to the federal government, and about half of that number that belongs to the state government, it means you have less than 2 on average for each of our tertiary centers. For the population of more than 200 million, talking about one endocrinologist for about 1 million population. This is definitely quite inadequate. To complete this issue is the issue of brain drain, which is the migration of health professionals for better opportunities. This could be within the country or across international borders. This has been of growing concern worldwide because of its impact on health systems. This migration of health personnel in search of better standards of living, better quality of life, higher salaries, access to advanced technology, and more stable political conditions in different places worldwide is what is defined as brain drain. What are the effects of brain drain on endocrine practice? Endocrine practice is not immune to what is happening to other aspects of medical practice, and indeed it's much more affected because we have earlier said that we are very few, less than 200, about one serving about 1 million of the population. So even one endocrinologist living means a lot in terms of effects on our system. The negative effects of brain drain are seen across service delivery, workforce distribution, training, research output, and health system cost, all of which leads to negative results. What are these effects on clinical practice? The clinical care of patients is affected adversely by the shortage of specialist endocrinologists. Management of many patients by overburdened general practitioners or non-specialists or generalists increases the risk of suboptimal management. Meaning, instead of an individual having access to a specialist, such individuals are seen by a generalist. So they hardly get the benefit of the services of an endocrinologist. This also leads to delays in the review of cases by specialists due to unbearable workloads and delayed diagnosis, leading to higher rates of complications. One can imagine people sent across several health centers, hospitals, with what needs to be seen by an endocrinologist for a definitive diagnosis, only for these patients to travel far and wide. And by the time they get to the place where the endocrinologist is, they still have to wait for so many hours, days, and sometimes there, or is there on a visiting basis. This leads from that geographic maldistribution of specialist leaves the rural and semi-urban population underserved. Lagos, for example, I'm sure has about 10 or 20% of the total number of endocrinologists in the country, which they will have maybe about 5%. And you have in some places maybe just one in the state, and in some states probably not even one. Meaning that in those these areas where there may be one or two, waiting times will be much longer. And those people who are attending to them get too tired and find it very difficult to continue. The next effect is on training and mentorship. It's very clear, as we see even today in our fellowship exams, both in the national and West Africa. There are few residents coming in for the program, and even where they are willing residents, the trainers may also not be available. So there is an impairment of specialist training programs, and well as a resultant lower fellowship count. So the effect will now be, even on the long term, they're not likely to get out of the problems of academic. Out migration of very senior specialists also leads to the loss of institutional memory and leadership in academic departments. You find people who may not know exactly how things used to be done. With time, we lose a lot in terms of our institutional memory, in terms of what used to be the norm in each of our departments. That is not so good for the image of our hospitals. Well as our institutions. Of course, it's obvious that few people will have more clinical work to do. They may have very little time for research. The result is whatever we apply will not be based on our local experiences. We may just be importing policies from elsewhere, which may not be good for our own environment. The other implication is on the economics of the health system. It takes a lot to train from undergraduate to specialist level, and by the time these individuals leave, it means we are losing investments, both for training undergraduates as well as for training postgraduates. And how do we advance endocrinology care in the setting of this brain drain? One law of nature is for an individual or system to survive, challenges to be converted opportunities. Challenge we now face is that of brain drain leading to death in the specialist provided endocrine care. So how do we convert this challenge to an opportunity? There are two basic things that we need to do. One is to convert brain drain to brain gain, and the other is to leverage on the advances of ICT. How do we turn brain drain to brain gain? And in brain drain, and capital back home that they can physically or not. Is leveraging on advances in ICT. Advances in ICT has been quite enormous. We have just seen the lecture on IT, which was in an age where people do conditions thousands of kilometers away, where surgery is performed thousands of kilometers away between the surgeon as well as the patient. Specialist access for general practitioners interact with specialists. If a hospital that is 200 kilometers from Abuja, for example, where there's just a GP, should be able to contact a specialist in Abuja, either Gwagwalada National Hospital, Federal Teaching Hospital, to be able to know what exactly he should do. This can be done real time. Also, the use of mobile health apps to ensure monitoring the patients could also be useful. Furthermore, advances in ICT provides opportunities for in virtual training, through which clinicians will have access to online CMEs, webinars, online case discussions, as well as access to virtual simulation clinical skill laboratories. This will help a lot. An endocrinologist that has immigrated to the UK will help local people around here to have access to clinical cases, to have access to webinars, to have access to clinical skill laboratories that they may have that may not be available. That will help. And those are general statements made. What are the practical mitigation strategies that we need to do? I've divided them into three: short-term, stages between 0 and 2 years, medium-term, between 2 and 5 years, and long-time, more than 5 years. So let's look at the short-term measures. Telemedicine and telementoring will help to link endocrinologists who are remaining to general hospitals and general practitioners for case support and virtual clinics, as well as mentoring. Task shifting will also be used, and this entails the creation of multidisciplinary teams by training of non-physician clinicians, diabetes educators, pharmacists, and nurses, manage routine diabetes care and screening using standardized protocols. First thing is to have the standardized protocols and then trainings that should be monitored. The next is to strengthen primary care for NCDs by implementing simple algorithms for diagnosis and management at PHC level. That will not give optimal care, but at least some form of care will be given. These levels of care using those algorithms will know exactly when to refer, instead of just keeping those patients for a long time. Government should also try to look at retention measures, such as non-financial incentives, accelerated career development, protected CPD times, recognition, as well as flexible schedules to motivate endocrinologists to stay, to continue to develop this specialty. Because without them, the first three tasks enumerated above are virtually not possible. What are these medium-term measures? First is to expand specialist training slots and decentralize training to regional centers by building capacity, by protecting time and mentorship incentives. Of course, the issue we face today is not that the slots are not there. It's because the residents are not willing, because this Japa issue. So, but all the same, where the residents are many, and there is need for the slots, I think that can also go on. Next is to provide bonded scholarships or service agreements tied with public sector service for a defined period, fair conditions and monitoring. As it is today, our residency programs are not bonded. People can finish and just go. It probably only happens here. I think in most places, it's either you pay for your training, or if you are trained, you have to get some form of funding. But the trainees may also argue that the conditions under which they train are not optimal. So we optimize that for bonding them. So that if your program takes X number of years, you're going to spend Y number of years to serve in the public service. We need to improve laboratory and equipment support, invest in robust, low maintenance diagnostics, and train technicians to manage them. Especially in these IT days, some of the equipment need to be IT compliant. We need to engage the diaspora to support endocrinology training and practice by the provision of short-term return fellowships, visiting faculty, collaborative clinics, and tele-education. By these long-term measures, there is need for health financial reforms, reduce out-of-pocket spending. We need to expand NHIS coverage for NCDs, subsidize insulin and other essential medicine. Some may be wondering why I say this. Number two, we provide competitive, sustainable remuneration packages and career pathways for specialists. Because most people are moving elsewhere because of better remuneration. I think if we can do it, people will come back. It was done now. So much brain around 2001, 2005, most people came back because of improved education. We really need to look at our remunerations especially in this setting, for the depreciating value of currency, so that doctors and especially specialists should also be paid like the judges of the Supreme Court, including higher, and certainly much higher positions. We need to strengthen national NCD strategy implementation, data systems, and registries demonstrate impact of what we did earlier, long-term, short-term, medium-term. If we're able to demonstrate improvement, then that should be an impetus to attract more funding to continue what we are doing. There's also need to initiate and sustain public-private partnerships, expand access to specialized care, and invest in training and retraining. What are our recommendations? From the foregoing discussions, the following could be recommended. There's a need to start and sustain a national tele-endocrinology program, provide immediate specialist support, general hospitals, and remote clinics. There's a need to start and sustain a national nurse-led diabetes management program, community-based self-management and education, use specialists. There's the need to expand endocrine training positions with incentives to trainees who commit to service in underserved regions. There's the need to create a diaspora engagement unit by EMSON to coordinate and training programs. There's also the need to locate gated funding for co-diagnostic point of care and maintenance training for laboratory staff. What roles each task have to play these recommendations? Government should invest more in workforce retention by training, finance, health platforms, as well as infrastructure, integrate endocrine, as well as to integrate endocrine priorities in NCD plans. Our teaching hospitals and postgraduate medical colleges, on the other hand, should explore the possibility of increasing training slots for tech faculty time in new partnerships. Professional societies such as insurance, CPDs, care standards, and coordinate diaspora engagements. Clinicians like us should adopt task sharing models, participate in telementoring, and document outcomes to be evidence. Conclusion: brain is weakening Nigeria's capacity to deliver high-quality endocrine care. Measurable impacts on access, training, and outcomes. A combination of short-term clinical innovations, such as telemedicine, task shifting, long-term health financing, and retention policies can ameliorate effects of strengthening endocrine services. Engaging the diaspora, leveraging technology, and prioritizing primary care management, endocrine diseases will yield the fastest and most sustainable benefits. We may wish to go through some of this. Thank you for your attention, and let me apologize once again for not being available. If the program allows, should be available for himself. Thank you very much for your time.
Thank you very much, our very revered Professor of Endocrinology, Professor Adamu Bakari, our keynote speaker for today. I think he deserves another round of applause. Prof. Sir, we thank you. We know you have a flight to catch, but you also agreed to give us your time, and we thank you very much. Without much ado, we want to quickly move on to the opening ceremony for today, and to do that, we will constitute our high table. Dr. Korobusa.
Thank you very much. I think the topic was very interesting, and And I think one should pose a question to heads of units. How many of your consultants and residents are still around? I think we should start doing a small roll call. How many consultants, how many residents are around between last year and this year? And to show that brain drain is real. On that note, distinguished ladies and gentlemen, I want to quickly recognize our father of endocrinology, a royal father that has just come in. He's also our special guest of honor. Let me humbly welcome the man that also examined me, my exams in part 2. I want to recognize Ogberi Oja, Olori Ogun, Ogberi Oja, Olori Ogun, Ogbeni Oja, Olori Ogun, Dr. Sonny Puku, OFR. What score will you give me, sir? 2. So can somebody pronounce it better for us? But I don't want somebody from Yoruba. So it's going to be a challenge. I was just giving a score of no now. So who else? No, I won't give you. Ubong. No, I can panic you. You know, I have to look at faces in events like this. Say whatever you want to say. If you be very careful, you're close. Try.
Ogbeni Oja, Oloro Ogun.
Okay, so we'll do one last person. Bolanle. Oh yeah. If you make a mistake, Bolanle, you're finished. Oh yeah.
Ogbeni Oja, Oloro Ogun.
Sir, what is her score now? So, okay. So apparently 6 is the highest so far. Chinyere, you knowingly passed on that name to me. All right, we are going to also introduce the chairman of today's occasion, our father, Professor Oladapo Ashiru, OFR. I think I did well in that one, sir. My score, sir. Hey! Okay, our chairman is taking down. Then we would also like to have our president of EMSON,
Professor Andrew Uloku.
That's unfair now. You pronounce that one easily. We're also going to have some of our past presidents on the high table. And this is a way to say thank you for all you've done for the association. And I'm sure today you're proud where EMSON is. We want to invite Professor Kolawale on the high table. Professor Kolawale is also the book reviewer for one of key important events for today. I got 8/10 this time, sir. Thank you. I'm heading for 10. Now we will also invite our father of EMSON also, Professor Fasamade. Professor Olufemi Fasamade. I think I got that one well.
Yes, sir.
What's the score now?
10/10.
You are too much. Chi, you are too much. You are too much.
Okay, so to balance our high table, we also want to invite Professor Feyi Adegoke. I don't know if she's here to join this high table, ma. Okay, so we welcome you, ma, in absentia. We wished you would have been here to be part of our high table. So
sorry, Chi. Really, gender balance is very important.
Yes.
Very, very important. And we have a lot of our great fathers there. So let's train some of our mothers in.
Yes.
So I would naturally, as everybody would know, call Professor Felicia.
Yes. So that is 10/10.
Thank you. So for gender balance, we are putting them there. We would also call the COC chairman, Dr. Akinyele Akinlade. Where is he?
COC chair.
COC chair, we need you because we would also be giving your open address. It's not here.
Okay, I'm sure he will join us very soon.
So he will soon join us. With permission of our chairman of the day, sir, our royal father, special guest of honor, and our teachers, we would like to start this opening ceremony formally with the national anthem. And Chi, you will sing on.
May we all rise, please.
So may we all rise for the new, current national anthem. That. As the program goes on, we'll continue to recognize and thank people that have kept their society strong. We want to recognize the fellow of EMSON, my teacher and my academic father, Professor Sonny Chineye. Sir, you're welcome. A round of applause, please. You're welcome. We have many other distinguished people here, members of the executive, the ESCO. You're welcome. And truly speaking, the COC has done a fantastic job. We want to recognize them. Please, a round of applause so far for the COC for a good job. So at this point, we would like the COC chairman to give his welcome address. Sir, you may come this way, please.
Good morning, our distinguished special guest of honor, Olorogun Kuku, our distinguished keynote speaker, the president of EMSON, our past presidents, esteemed fellows and members of our distinguished society, our honored guests, dear colleagues, ladies and gentlemen. It is with immense pleasure and a profound sense of duty that I stand before you today on behalf of the Central Organizing Committee to warmly welcome each and every one of you to the vibrant city of Lagos for this 46th Annual General Meeting and Scientific Conference of our great society. Your presence here today from across the nation and beyond is a powerful testament to your unwavering commitment to the field of endocrinology and metabolism. Your journey to this point is deeply appreciated, and we are truly delighted to have you in our midst. This year, we gather under a theme that is not merely academic, but one that resonates deeply with our daily realities and the very future of our healthcare system. Endocrinology in Nigeria, Advancing Care Amidst Brain Drain. This theme was chosen with deliberate introspection. We are all acutely aware of the silent pandemic sweeping through our wards and clinics, the relentless migration of our brightest and most skilled medical professionals. This exodus poses a big threat to the quality of care we can provide to the millions of Nigerians living with diabetes, thyroid disorders, hypertension, and other complex endocrine conditions. Yet, to focus solely on the challenge would be to ignore the incredible resilience and ingenuity that defines us. This conference, therefore, is not a forum for us to lament, but a gathering to provide solutions to this brain drain. It is a call to action. It is an opportunity for us to critically and courageously address the pressing questions. How do we fortify our systems? How do we innovate in training, retention, and technology? How do we build sustainable models of care that are not crippled by this drain, but are adapted to thrive in spite of it? Over the next 3 days, we have curated a rich and robust scientific program that is designed to empower and inspire. We are privileged to host a faculty of world-renowned experts, both from within Nigeria and our diaspora, who will share groundbreaking research, innovative clinical practices, and pragmatic strategies for navigating our current landscape. We will engage in plenary sessions, interactive workshops, and vibrant discussions that will challenge our thinking and expand our horizons. We will also celebrate the brilliant research of our trainees and young endocrinologists who represent the hopeful future we are fighting to secure. Beyond the lecture halls, I encourage us to network, to connect with old friends, to forge new collaborations, and to strengthen the bonds of our professional community. It is in this unity that we find our greatest strength. My sincere gratitude goes to the Executive Council of EMSON for their unwavering support, to all the members of the Central Organizing Committee for their tireless work, and to our sponsors and partners for their belief in our mission. I'm especially delighted at the diversity of delegates that are present at this conference. Our colleagues from across Nigeria, our partners from other specialties, our international collaborators, and the younger generation of doctors and trainees who represent the future of this society. You are the heart of this conference. Your participation energizes this conference and reminds us that while brain drain is real, brain gain, brain retention, and brain collaboration are equally possible through vision, commitment, and shared purpose. So let us learn from one another. Let us be challenged. Let us live here not only with new knowledge, but with renewed determination and a concrete blueprint for advancing endocrine care in Nigeria. Once again, I warmly welcome you to this 46th Annual General Meeting and Scientific Conference of our great society, EMSON. May our deliberations be fruitful, our collaborations enduring, and our collective efforts translate into better care for our patients and a stronger future for endocrinology in Nigeria. Thank you and welcome to this conference. Please enjoy the conference.
Thank you very much. That was the welcome address by the chairman, COC, Dr. Akinyele Akinwade. Thank you very much, sir. Okay, please, a little announcement. Dr. Edomo, the mother-in-law is outside and she just needs your attention. Please, just step up for a minute. Thank you. Okay, so another round of applause, please, for Chairman COC for a fantastic job, sir. I actually want to applaud your team. We walked into this ambience, we liked what we saw, and so far so good. So we want to say thank you very much to you, sir. So very quickly, we are going to call on the big masquerade in the house, our President EMSON, the President of EMSON. We want to welcome Professor Andrew Uluku for his welcome address. Welcome, sir.
The chairman of this opening ceremony, Professor Oladapo Ashiru, the special guest of honor, our father, the founding father of EMSON, Honorary Life President, Ogbeni Oja Olorogun, Dr. Sonny Kuku, the keynote speaker who delivered an excellent keynote just a while ago, Professor Adamu Bakaregire, the past president of EMSON, my big brother and friend, Professor Olufemi Fasamade, the immediate past first vice president of EMSON, Professor Kolawole, the editor-in-chief of the African Journals of Endocrine and Metabolism, my big sister, Professor Felicia Anuma, the chairman, Central Organizing Committee, Dr. Akinlade. Permit me to also recognize eminent senior distinguished teachers and colleagues that are on the floor of this opening ceremony. I recognize especially Professor Rosemary Ikem. I also like to recognize Professor Sonny Chineye and Professor Samuel and all other professors present here. Eminent senior colleagues and colleagues, members of the press, distinguished ladies and gentlemen, good morning. The MC was setting a big trap for me when she said that she was inviting a big masquerade. Yet, I was feeling somewhat uncomfortable sitting with grand teachers on this high table. I was actually whispering to Professor Kolawole that I felt like hiding at the edge of the table because it's a privilege to sit with grand teachers and teachers, people that are world-renowned at this gathering. I would like to briefly go through my welcome remarks. I don't know if this should be a welcome address or a speech by the chief servant of EMSON. It's a full year that has turned since our last annual general meeting and scientific conference, which was held in September of 2024 at Abeokuta in Ogun State. It has been a remarkable year of very pleasant achievements and positive impacts in the growth of our cherished professional society, EMSON. We are happy to be back to Lagos, the center of excellence, the birthplace of EMSON, at this 46th Annual General Meeting and Scientific Conference, tagged Lagos 2025. At this annual meeting, in this remarkably ever vibrant city of Lagos, we aim to engage and exchange latest knowledge, scientific breakthroughs, as a professional body of endocrinologists, present the latest evidence in endocrine health, address topical endocrine and metabolic issues of public health importance, and launch a landmark first ever of its kind, EMSON Standard of Care Guideline on Diabetes Mellitus. I thought there would be a round of applause for that. The Endocrine and Metabolism Society of Nigeria is, in brief, the umbrella professional body of all endocrinologists and endocrine-related practices in Nigeria. Its membership is spread across the 6 geopolitical zones of this country, as well as an active population of endocrinologists in diaspora, the group that we call the EMSON diaspora members. As endocrinologists, we undertake research, clinical practice, teaching, training, and community service in the fields of endocrinology, diabetes, metabolism, and nutrition. Our membership has continued to grow year in, year out, touching the lives of Nigerians in many positive ways. We continue to contribute to the science of EDM and N, as evidenced in the several research publications and presentations at notable world fora. The theme of the 46th AGM Scientific Conference, Endocrinology in Nigeria, Advancing Care Amidst Brain Drain, is well thought out and timely given the current wave of massive emigration of endocrinologists and endocrine-related healthcare practitioners to other countries for varied reasons. The full implications of these endocrine-related JAPA will be deliberated upon during this meeting. Our sub-teams covering emerging biomarkers in diabetes, disorders of puberty, menopause and its complications, cardiovascular complications in diabetes and thyroid disorders, will provide this conference a unique opportunity for improving the EDM health status of our people. We have carefully put together an array of experts from across the globe to weigh in on this well thought out team and sub-teams. As we gather at this 46th EMSON AGM Scientific Conference, we remember our dear colleague, sister and friend, Dr. Geraldine Nneka Chukwuma, who slept in the Lord on the 27th of October 2024. That was shortly after we departed from Abeokuta. Late Dr. Geraldine Nneka Chukwuma was a consultant endocrinologist at the Federal Medical Center, Yenagua, Bayelsa State, until her untimely demise. We also formally identify with our members who, in the course of the past year, have lost a parent or family member. May I humbly request all of us here present to rise and observe a minute silence in prayer for the peaceful repose of the souls of Dr. Geraldine Nneka Chukwuma. May her gentle soul and the souls of all our fallen family members continue to rest in peace. Amen. Please take your seat. I invite you to settle down to yet another set of great learning opportunities. Make the best of an extraordinary networking possibility. Enjoy the ever vibrant and energetic city of Lagos and its hospitality, and savor the fantastic cuisines of Lagos. On behalf of the Executive Committee, leadership, and members of EMSON, I thank the Central Organizing Committee of this 46th AGM Scientific Conference, ably led by Dr. Akinyele Akinlade, for the exceptional hard work, dedication, and diligence in putting this great meeting together at a very challenging time like this. We celebrate the COC for demonstrating the unique EMSON family spirit that bettered this exceptionally well-organized AGM Scientific Conference. We especially appreciate the Executive Governor of Lagos State, His Excellency Mr. Babajide Olusola Sanwo-Olu, CON, for allowing the hosting of this meeting in Lagos. We especially recognize and thank profoundly the immense contributions of the several pharma industries and all other well-meaning corporate organizations that have partnered with us in achieving a successful AGM Scientific Conference. It is my singular honor and privilege to welcome all of us once again to this 46th EMSON AGM Scientific Conference, tagged Lagos 2025. Long live EMSON, long live Lagos State, long live Federal Republic of Nigeria. Thank you very much.
Another round of applause for our President, Professor Andrew Loku. At this time now, we're going to the next item on the program. Opening remarks and speech by the chairman of the opening ceremony, Professor Oladapa Ashiru, FR. Please, a round of applause.
The special guest of honor, my dear brother, the Olurogun and Ogbeni Oja, and acting Awujale and regent of Ijebuland, Professor Sonny Folonshoku, I salute you. The president of EMSON, Professor Andrew Loku, I salute you. And I welcome all other past presidents and distinguished members of EMSON. It's a great honor for me to be asked to chair this occasion. And when I was told, I had no problem accepting to be here, because endocrinology is probably an innate gene that has developed in me. When I was introduced to postgraduate training in anatomy, I found myself doing high-powered research in reproductive endocrinology, which has cumulated to the pioneering work we've done in this country in assisted reproductive conception. And that is a landmark in history. I want to just comment on the advancing care amid brain drain, especially with regards to endocrinology. And it appears to be the theme that has been going around in some of the conferences I've been attending in recent times. And I will just focus on 4 points and I will leave. The first is, today, or let me just step back. Why are we in this problem of brain drain? Why? There was, and there has always been brain drain in Nigeria as far back as before independence. Our seniors, they went abroad to train. It was brain that drained to train. But no sooner than they finished their training, they came back home. It's so incidental. Yesterday, we were at the academic commendation for Professor Unyade Lebute. She and her husband trained in Birmingham. And they came back to work in Ibadan, UCH. And they then moved to join Professor Thomas and Joseph in starting the Department of Physiology, Department of Surgery, the whole entire College of Medicine. So, what changed? Very simple. The commitment has changed. Especially with the medical profession. Those who look at doctors with envy, they got into power. Especially because I know this because I served my National Youth Service in the Nigerian Navy as a flotilla medical officer, surgeon lieutenant, and interacted with the medical with the entire military. They look at doctors like that, and slowly but surely, from 1974, from the 1966 coup, the integration, the reversal has continued. When before Sir Manuel was the Inspector General of Health Services and was next, we used to act for the head of state. And then by the time Manuel retired, he wanted to hold on to that office. And so the next person was not properly handed over that position. That is what you call inter-professional rivalry. That has cut us down. Same thing with Nigerian Medical Association. The leadership changed and it was radically taken over from people who should have been there, that would have been interacting at the government level. And that also caused a problem. Now, the commitment that is not there globally, I was looking at the 2025 budget. Nigeria votes 9.8% of its budget to defense. Can you understand that even the developed countries like Britain, France, they're just struggling to move their defense budget to approach 5%. And if you now look at the sad part of this, that if you look at the money that have been voted for defense in the last 20 years, and you look at the infrastructure of defense, the equipment, some of them are obsolete. Some of them are not working. So it's just like, now how much are we voting for health? Now, America votes about 7% of their budget on defense. For health, they are trying to increase it from 27% to 30%. What is the vote for health for Nigeria? We are moving 4.9%. We're just trying. We've never gone above 6% except for once. So the commitment for health is not there. The commitment in this country today is in terms of the sharing of money at the political level. The money that goes to the National Assembly, to sitting allowance, constituency allowance, is substantial and will have done a lot. So why would there be no brain drain? I can talk about this, but in the midst of difficulties, man must face challenges. as John F. Kennedy says, man must go to the moon and return. Not because it's easy, but because it's difficult and because we have to achieve it. So, we, the medical profession, we must face challenges and return. I will give you 2 examples. When I was motivated by what we call mentorship, it was Professor Doseku and the likes who said, Ashiru, we want you to go and study anatomy, because they were telling us that Nigerians cannot understand anatomy. That was 1971 when I did my secondary. All the teachers of anatomy, all the professors, teachers of anatomy in Nigeria at that time, they were foreigners from Britain, from India, from Pakistan. So I went for my postgraduate training. And on coming back, I was mobilized back because my head of department had stroke. And they said, you need to go back. And that taught me a lesson, that when I get back, I'm not going to do it alone, because I don't want to have stroke. So I started mobilizing students to come into anatomy. I started the postgraduate program. And today, in anatomy, even at the College of Medicine, they have so many professors there, close to 7 or so, that were trained through that program. And today in anatomy, I was at a town hall of the Anatomy Society conference. We have almost 400 anatomy teachers and about 80 professors. That was what they said Nigerians can do. The next example has to do with assisted reproductive technology. We started it in Louth. Louth was the only center doing IVF. But through mentorship and programming, I will give you an example. Professor Adeshola was VC, and the special guest would know this. There was a department where the head of the man was professor. And I say this because some of us are senior in this environment. He was a professor. The next person to her was a lecturer one. And they stayed there for years. She was not promoting them. Until the vice chancellor said, this one-man show cannot stand. That lecturer one will be coordinator of the department. And she was made to be acting head and coordinator. Eventually, she got exposed, moved to be senior lecturer, and that was how that department proliferated. I say this, that a professor is not known by what he professes alone, but by how many professors you are able to train. And you have to do this. And so, we're talking about assisted reproductive technology. It was one clinic, it's 4. Today, we have 400 IVF centers in this country. And we are training them to be of great level. When we realized that the embryologist was a new field, I started an institute for assisted reproductive technology to train embryologists. I tell you one story. We've been on this matter for almost 6 years. At the postgraduate medical college, some people stepped up. They frustrated it for 4 years. I said, we're trying to develop manpower for our country. So, in the midst of all these things we are doing, a lot of frustration is coming from our own members. Now, For endocrinology, it is hard time. I don't understand why, as of today, we cannot have an endocrinology training institute in different sections of the university where we can mentor people into the different branches of endocrinology and train them. It should happen so that we talk about brain drain as they're going. Now, in my own center, people are taking those embryologists and nurses to Europe, to Spain. I called some of the professors, you are taking my own staff. You are the one that's supposed to be. They said, but we like the ones you sent for us. So I cannot end up by not telling you that there is an adaptation that can also be used. In America, they talk about adjunct professorship. I've introduced this to the University of Lagos. They are now accepting that people in the public sector cannot do it alone. You need the private sector. The lives of people who have institutions that are in private practice and they're good should be made adjunct professors in those other teaching hospitals to balance up for the brain drain. And I think on that note, I thank you all. I wish you a good Congress. And it is therefore my pleasure to declare this Endocrine and Metabolic Conference open.
Thank you very much, our very able chairman, the person of Professor Oladapo Ashiru. Thank you very much, sir. Okay, so very quickly we will move on and we'll call our special guest of honor. Please give me 10/10 after this pronunciation, please. So we'll call our special guest of honor, sir, Ogbeni Yoja, Olori Yogun, Dr. Sonny Folorunshokuku. Did I not try? Welcome, sir. Sir, we call you up for your speech, please.
Okay, you scored 10.1/10. Mr. Chairman, our great pioneer, at the time when in vitro fertilization was rocket science, our chairman and his colleague, Professor Sato Giwasage, who is also a member of the society, produced the first test tube baby. And let me tell you, instead of them getting an applause at that time, there was so much discord. Everybody went after them that they were producing what they called chemical pregnancy, biochemical pregnancy, and that they challenged them to produce live birth, which they did. And today, it has multiplied, and today, many people very close to all of us have benefited from that simple IVF production they did. And we thank you very much. And he's also the first African secretary of the World Fertility Society. Mr. Chairman, thank you very much. And my president, this is the president of Ogbeni Oja, which makes him very, very important in this world. You are very powerful. Distinguished members of the High Table and distinguished endocrinologists. When I went into endocrinology, I could count the number of endocrinologists in the palm of the hand. It's so pleasant to come here and find a room full of endocrinologists. and the numbers have increased every year. And not only do we now have Society of Endocrinology, we have Society of Pediatric Endocrinology, Society of Thyroid, the Thyroid Study Group, and so on, which is fantastic. I can tell you, when I came I came into the teaching hospital as a senior lecturer. It was a Herculean task. It was so difficult. The chairman will remember, and I'm sure maybe one or two people remember, that I met the greatest opposition I've ever seen in my life. If I got to a point where the head of the unit was taking out the plug so that we could not do experiments. So instead of encouraging people to come, a lot of people left. And that's one of the reasons that we don't put clearly, that we don't say that it's not so clear, that people just drain off. And you have international brain drain, but you also have local brain drain. And because of that, the Endocrine Society department in Louth had people who drained into the private sector. In many ways, Nigeria still benefited, but the skills that they could have used in the teaching profession were lost into the private sector. And the private sector, and instead of, like you said, the concept of adjunct professors were not really looked at. There were assistant lecturers, and they were made to look like poor cousins, and most people just refused to be part of it. So, but when we started the society, let me take you back memory lane. There were only 6 identifiable endocrinologists in the country. And I could name them and you might know them. Professor Grillo was a distinguished anatomist. I don't know why anatomists are the people who have been pioneers of endocrinology. They taught us to go back to the anatomical physiology. We had at the same time Professor Lee, if you remember him, in the group, Professor Edozien, who became Asagba of Asaba, Professor Johnson, and Professor Elebute. Professor Elebute, the 2 professors are very interesting because when we started the society, we called it Society of Endocrinology and Metabolism, which is what is still there. The metabolism part of it was the one that interested the physiologists and so on. And they started studying electrolyte and endocrinology and such obscure parts. And it turned out to be very interesting. And then Professor Hove really joined. I was secretary, and we immediately passed it to him because we would have a conference, and the conference would be of 10 people. You can imagine, so all 10 of us had offices. We were all officials of the society. And then we were lucky at that time that a laboratory, which was founded by myself and Dr. Akiochi, was there. And that society mentored the Endocrine Society, paid for people to travel abroad, paid for this type of conference, paid the whole, because how much can 10 people put down to start and you can see where we are today. That's why they say little drops of water make an ocean. And that's so important. And I can see it's going from strength to strength. And we must continue. I came in today and I walked through what I would call a a situation in which the advertisement came from Festac town. The advertisers came from Festac town to here. Before, if we had half an advertiser, we did very well. So it just shows how far we have gone. And we must continue. The interest must be made to go on to ensure that our fellows and our endocrinologists continue to join the society. They must see what they can get from it. That's life. And so we must produce programs that train, which we do already, I can see. We've taken the matters to the zones, which is a very good way to collect people together. And let's keep at it. The last time I was at a meeting like this was 10 years ago. It was in Ibadan. And to my own joy, today, for instance, now, the society has grown even bigger. And we must keep up this good work. And the various sections that are formed should please not become so independent to leave the mother society in a situation where it becomes depleted. There must be a way in which the endocrine society can get the various other societies, like the pediatric endocrinologists and so on. I even see there is a society of clinical endocrinologists now. Is that correct? Yeah. It's all right. I think it's a very good idea. But all those societies should come together and make this very strong. Let me not say much more, but to say thank you for inviting me. The position of honorary life president is something I love so much. I want to be president like Uloko, so they can be calling me president something, you know. And Professor Solite Chine and the Diabetes Society, he used to be such a, I don't know what to call him, such a young person, making sure that the place ran. Now he's a father of diabetes. Can you imagine? So some of us are getting really ancient. And soon he will probably become honorary life president of the Diabetes Society. So ladies and gentlemen, thank you for inviting me. You may not see me all the time, but in the background, I'm present for this society, and I'll be present forever. Thank you very much.
Please, another round of applause. Another round of applause. The chairman of today's occasion and our special guest in honor, distinguished members of the high table. I think we've taken some lessons here. The first one is that we need to commission a committee for the history of our society. And Mr. President, sir, I think that onus falls on you and your ESCO, which I happen to be one of. So we should think of writing our history directly from the origin, the people that started it. This is the best time now to get our details down. The other thing, of course, is to remind ourselves to inspire and mentor people. So I don't know how many people here have their mentees here. Please, if you have your mentees here, raise your hands. Raise your hands. You have your mentees here. It's very important that your mentees should come and push and push. How many professors have produced professors? Yes. We are seeing them. Yes. So, very good. So, please, it's important for us to move because, truly speaking, the brain drain is both local and international. On that note, we move to the section of goodwill messages. I would like to, first of all, start by recognizing somebody, requesting that she humbly gives her goodwill messages, and then we'll take her to the high table. I'd like to recognize Professor Oyenusi. She is the president of the African Society for Pediatric and Adolescent Endocrinology. Ma, you're welcome. You're welcome. She's one of us. Welcome, welcome. So, Ma, goodwill messages or message, and then we'll join to balance the height.
Good morning, everyone. The special guest of honor, the Ogbeni Oja Olorogun, the chairman of the occasion, my own anatomy teacher, many years ago in University of Lagos, the past president, the present president, the high table is full of my teachers, my mentors, those people that have built us up. And it's heartwarming that 15 years ago, I attended my first EMSON as a senior registrar. I was doing my pediatric endocrinology posting then in Nairobi, my training. And the family spirit I saw made me stay put in endocrinology and in EMSON. And so from the entire membership of the African Society for Pediatric and Adolescent Endocrinology, I bring greetings for what the Endocrinology and Metabolism Society of Nigeria is doing. We are delighted, we are encouraged by the partnership that we enjoy. And I want to say that Nigeria is very pivotal in building up endocrinology in Nigeria, because even in pediatric endocrinology, the membership of ASPE, out of 120 members of ASPE, about 60 of them are Nigerians. So we are talking as an EMSON member. I'm very proud that EMSON is holding its 46th conference, and we have a special place in advancing the care of endocrinology from the cradle to adulthood, to make sure that endocrine disorders are diagnosed on time, that all the necessary tests are being done, and the different sections, as Dr. Diogbenyo just said, the biochemists, the pediatric endocrinologists, the adult endocrinologists, everybody's working together to make sure that we provide optimal care. And as the chairman LOC said, is not all woes, is not all cries. We have advanced in care. We are able to do genetic studies for some of our children, some of our patients, both children and adults, and they are evidenced in the papers that are being presented in this conference. So I want us to continue the collaboration that we do as adult endocrinologists, pediatric endocrinologists, and on behalf of ASPE, I wish us a successful conference. Thank you.
Thank you. Another round of applause. So we're moving. We need to catch up with time. So the next thing to give a goodwill message for just 1 minute, Professor Sonny Chineye. Sir, a round of applause, please.
Thank you. Yes, I'm just giving only 1 minute. Yes. I don't need to say much. All I need to say is to thank some of my teachers on the high table, particularly Professor Sonny Kuku. He may have forgotten. We are namesake. Many years ago, I finished residency program. That time, Professor Dagojak has left. Again, brain drain. There was nobody to cling on to. But I insisted that I must do endocrinology. Several years passed. I wasn't getting through with my dissertation. I still remember one of my mentors, although he's currently in US now, with his children. So you know Professor Chris Hanna? Yes. So one day he come and said, son, come over. I want to send you to one of my friends in Lagos. He has a private lab so that you go and discuss with him. And that's our special guest of honor today. Send me to him. And after talking to him, he accepted me. I ran all the tests at Radio Immunoassay Lab in Ebute free of charge. And without that gesture, there's no way I would have finished or ended up being an endocrinologist. Maybe I would have been tempted to do another source specialty, but that time there was nobody. So I thank you, sir. And of course, even when I was some of you may not know, he's actually one of the founding members of the Board of Trustees of Diabetes Association of Nigeria. Yes. And till today, he has kept on supporting Diabetes Association of Nigeria. So thank you, sir. Then, of course, the message from the chairman is this. There is no success without a successor. That's just the message you have to take. So, I think in those days, moms, they used to say, if you are a director, direct well. If you are a professor, I think you have to profess and produce more professors. And I will give an example. Dr. Korobo is standing here. I'm sure in a very short time, the news will come that he has attended the full chair. His own father was a medical doctor. In fact, his father mentored me. His father was instrumental for me to go to do residency program because in those days, you could practice as a medical officer and end up as CMO. My father said, no, go. My father even was a PAMSEC, the Minister of Health. You know, he mentored me because I developed interest and had to go for residency program. Dr. Ike Korobo, today, some of you might not know, he was my student, he was my house officer, he was my resident. And I'm sure in a very short time, he's going to become a professor. So there is no success without a successor. And today also, as I'm talking to you, he's the head of Department of Medicine at River State University Teaching Hospital. My last child is a house officer under him. So you see, they say one good turn deserves another. Yes, exactly. So that is how. So for the younger people, I don't think we should lose hope. I still believe that despite the brain drain, the future is still very bright, even if you stay here in Nigeria. There has always been brain drain. In fact, first you remember in those days when we were in Ibadan, when we were students, you remember Professor Deti Ubi, they left. Professor Nadeko, they also came back. So there will always continue to be brain drain, particularly these days of globalization. We cannot escape it. But wherever you find yourself, remember that there is nothing like home. And with technology now, you can achieve a lot wherever you are. You can navigate through. So I thank the EMSON COC for putting this up together. We should keep it up. We should keep it up. I still believe that the future is very, very bright. There is focus for land. Thank you.
Sir, is another round of applause for my academic teacher, my father. Thank you, sir. Chairman of today's occasion, our special guest of honor, distinguished members of the high table. We are going to a very important event. I would first like, with the permission of the chairman, to ask all the fellows of EMSON to please come out. Those that have gotten the highest honor that we can give to our members. The fellows of EMSON should please come out. All the fellows of EMSON should please come out. Some people, they will whisper the ancestors of EMSON, but not be me talk. They may whisper, these the ancestors of EMSON. All the fellows of EMSON, minus Oloropa. Not be me. Sorry, sir, it's not me that called you out. Don't fear. All the fellows of EMSON, I will at this time call the current president of EMSON, Professor Andrew Oloko, to come out. If you look at item number 9, the current president of EMSON is going to be conferred with the EMSON Award. Usually it's a grand ceremony, but for today's opening ceremony, we'll just do it a little formal and straight to the point and skip some of our normal traditions. I will give the mic to Professor Fasamadesi. Sir, you will direct the affairs, but more importantly, we would like you to just in a line or two tell us the importance of the fellow. Thank you.
Okay. Thank you very, very much, Dr. Korugo, and to all the fellows that have been before me and the very few after me, and to all the members. I'll just give you a brief history of what the fellowship is about. About 10 or 15 years ago, it was decided that we should have different categories of membership. Before, we only had the active members, and then we also had honorary life members, of which the Olorogun and a few other people, Professor Ovrole, Professor Ashiru, were members of that particular group. And then it was felt that we should have another level, because when you go to the Royal College of Physicians, you also have fellow of the Royal College of Physicians. When you go to various organizations like ACE, we also have those who are fellows of ACE, but we didn't have any fellow of EMSON. So at that time we had, it was NSEM, Nigerian Society of Endocrinology and Metabolism. So we decided that there should be a fellow of the Nigerian Society of Endocrinology and Metabolism. So you find that among us here, there are two categories. There are some people who are conferred with FNSEM. So if you see that after my name, that is the fellow of the Nigerian Society of Endocrinology and Metabolism. But a few years later, when the government forced us to change NSEM to EMSON, new fellows were now given the title of FEMSON. And I think they should pay me royalty because my first name is Femi. So maybe it was after me that they also wanted it to be. So now I have plenty of children who are FEMSONs. So that is the brief history, and it is usually conferred on people who have been active members, who have paid up their dues for over 10 years and have a lot of accolades in terms of mentees, in terms of track records, in terms of footprints, big footprints in endocrinology. Those are the people who are conferred with the title of FEMSON. So Professor Andrew Oloko has been examined by the award committee. He has been a professor. He has been an endocrinologist for over a decade. He is a mentor of other mentors. He has raised people who have risen to the professorial grade. He's a very, very well-lettered person. And unanimously it was felt that he is worthy of joining the group of people that you see on this floor, on this side. So I want us to give him a round of applause. And then after that, I will hand over the microphone to the oldest FNSEM people and also life residents to continue from there. So I will hand over to the Ogbeni Oja and also to Professor Ashiru to do the honor of welcoming Professor Andrew Oloko to this fold.
Professor Fasubade, thank you. I think you summarized the reasons why Professor Andrew Loco deserves to be a fellow. In fact, in many societies, if by the time you become mature enough to be president or you achieved enough, you're actually automatically a fellow. And Professor Loco, I believe, deserves this. And he's done some seminal work in diabetes and other things. In fact, some of his work have been published in high impact papers. And not just that, he's shown so much interest in society. I believe he's more than qualified to be a fellow. And sooner or later, he will rise to become honorary life president. After President Fasomade, honorary life president, not to talk about honorary life president Ashiru. So congratulations, Professor. I hope we have certificates and so on to present him with.
Later, sir, not right now, because of what we fast.
Oh, later.
What we want is advice and your blessings.
No, he has all the blessings, and unless he wants to hear the blessings in the Ijebu. All right, thank you very much, Professor Ashiru.
Thank you very much. And I can tell you something that for a very long time, I was privileged to see the assessor, the prominent assessor from my professorship, even though he was at the age of 32. He said, the title of professorship is reserved for very few people who have excelled in at least 3 of the following: academic, research, teaching, and clinical work. And he said, Ashiru has excelled in the 4. So thereafter, I started assessing people for professorship in those 4 categories. For fellowship, I added the 5th one, which is you must have excelled in mentorship. You must have been able to mentor people. And that is what we use in the Academy of Medical Sciences. And Professor Luku, I looked at your CV at the time you were going for presidency, and I realized that you have excelled in those categories, and you are due to be a fellow. And I welcome you into that category. Thank you. Congratulations. Congratulations.
Please, where are the paparazzi? Picture. I'm standing here. Please take me also, so that soon I'm giving a gap here for my own safety. I'm giving a gap for my own safety, but put me around the perimeter. Thank you very much. Thank you. All right, thank you very much, Mr. Chairman and members of the High Table and the Fellows. Thank you. So we are now moving on to another important event, the EMSON Guideline launch. The first of its kind. Yes, first of its kind. We will start with the book reviewer. The guideline reviewer is Professor Baba Tope Kolowale. Have the mic.
Oh, I think I'm used to holding something. Thank you very much, Dr. Kurubo, the chair of today's opening ceremony, own Professor Ashiru Olorogun and Ogbeni Oja, distinguished members of the high table. It is a great privilege and honor to review the first of its kind guideline and standard of care document produced by our great association, Endocrine and Metabolism Society of Nigeria. Next slide. Thank you. So I begin with historical perspective. The need for a guideline has been a recurring issue for decades. When we go for meetings both locally and internationally, we had nothing to reference. And I believe what we are doing today is symbolic, and it's moving to the next level, solving this critical problem for us. Going on from there, I must also not fail to acknowledge previous efforts in this direction, especially that of the Diabetes Association in Nigeria. Professor Chinenye, I think when he was president of DAN, there was an effort to produce a guideline, which I believe is still in existence to today. So thank you for that effort. Beyond that also, in the period 2023 to 2025, the society took bold steps with the assistance of industry partners and other friends of the association to come together, put heads together. I think meetings held several. Of note is the meeting at the, I think, forgotten the name of the hotel. Mr. President, will you, in Nikeja? Amber, is it Amber? I think Amber Residence or so. This meeting brought together experts from all over. And that kick-started the process of putting together this guideline that you are launching today. And in this respect, too, I must not fail to acknowledge the sterling effort and contribution of our late past president, Professor Anwar Iregi. It was in her tenure as president that she worked so hard to bring that team together. May her soul continue to rest in peace. Today, EMSON has walked the talk. We have grabbed the bull by the horn, and we have been able to put together a document of international repute and recognition. What we are launching today will no doubt impact not just the practice of endocrinology at all levels, whether primary, secondary, or tertiary, but also it will enhance our research and help all those who are upcoming, our mentees, to aspire to be what the fellows that we just talked about are. So let's look at the guideline per se, the guideline proper. I've looked at it in two ways. First, general comments, and then specific comments. General comments, you look at the book. The cover is not necessarily hard, but soft, but very durable. It means, therefore, that it can be placed anywhere, easily placeable. In clinics, in the wards, in our practices, in our offices, It's handy, easy to carry about, and very rugged. The binding itself is tough, so you can open it repeatedly without the fear of it being torn or being in tatters. That's one important attribute of the guideline. What I also saw about it, that I admire so much, is that it's pictorial. It's full with pictures, charts. By the time you read 100 words of text and you see just one picture, the picture of the chart stays with you longer. So that's a major plus. Everything written in the book is also fully referenced. So it can also serve as a reference material. All the references, the sources of information are fully cited. The font size and type, to some extent, I believe that relative to the size of the book, we can still make that better. But for those with good eyesight, it is quite readable. All the contributing authors and contributors to this guideline were also properly referenced. And that's the way to do it. Industry partners were also acknowledged. So let's now look at some specific things. It began with the table of contents, which is as expected of any literary production. It has a list of abbreviations, so you can just look at that list, and then it can take you to exactly what you want. So you don't need to continue to search and search and search. It has a foreword written by none other than the Ogbeni Oja himself. He's endorsing this guideline as already giving it global recognition. Won't you agree with me? Let's give him a round of applause. Our acknowledgement was written by the president, our own president, and the fellow of EMSON. Also, the preface was written by the chair of the guideline committee, none other than Professor Olufemi Fasomade. And then it has 12 chapters in all. Chapter 1 deals with the scope, framework, and evidence base information you need. Chapter 2, classification and diagnosis. Chapter 3, evaluation, another investigation, analysis. Chapter 4, prevention, lifestyle modification. Chapter 5 deals with management, and on and on and on like that. DM emergencies, DM foot ulcer, DM in children and adolescents, DM and the Ramadan fast, DM and the Christian fast, diabetes and pregnancy, as well as diabetes in the elderly. Now a more detailed analysis, looking at strengths and weaknesses. This is where I will dwell on a little bit. The strength of this guideline is that, without doubt, evidently, in fact, incontrovertibly, this is a comprehensive masterpiece. Looking at all those sections that are covered, anybody can pick it and become acquainted with diabetes and its management just reading through it. So it's a comprehensive masterpiece, and kudos to those who worked there to produce this document. Number 2 is that it is handy and it has durable covers. So you don't need to go and spend money with buying that today. It has sections devoted to peculiar situations in the management of diabetes, including diabetes in children. So it's an all-inclusive. So our colleagues who manage children also add a contribution to it. DM in pregnancy, and also DM in elderly. Special situations are considered. It has, therefore, wide applicability at all levels of care, primary, secondary, tertiary, just name it. One other strength is the vast array of contributors, specialists in their own right, people who have been well published, who are well researched in the areas in which they wrote. And it is easy to comprehend, despite of the fact that it was written by experts. The language was simple. It carried information effectively. However, I identified a few weaknesses. First, the publisher was not mentioned. At least we should say that the publisher is EMSON. And the International Society book number, ISBN, is missing. We need to, when we are revising, we need to do that. Even though at the beginning, the evidence base was cited, but for a lot of practice statements, the evidence level was not cited in some instances. The foreword was misspelled forward. We need to correct that. And then the preface was not labeled, even though it was written by Professor Pasamadi, it was not labeled as preface. Some dietary recommendations in the dietary recommendation section did not reference local staples. We may also need to work on that, referencing. I know a lot of studies have been done on our local staples, including things like beans and beans products. And then, relative to the size of the book, I consider the font size a bit on the small side. So those who don't see well will not be able to read without glasses. Recommendations, as I begin to round off. First, and this is very, very important, I strongly recommend the adoption, ownership, and utilization of this guideline at all levels of care. We need to just push it out there, the primary, secondary, and tertiary levels of care. It finds applicability. Also, very, very importantly, all key stakeholders, including the Federal Ministry of Health, the State Ministry of Health, pharmaceutical companies, other professional societies, public-spirited individuals, diabetes associations, all, and I emphasize all, should support and promote the publication, dissemination, and utilization of this great product. It's a great product. EMSON, on our part, we should work towards producing similar standards of care and guidelines for the management of other endocrine conditions. I think that should be the next step we should be going to. Thyroid, for adrenal, and the like. In the next revision, what should we be seeing? Definitely there is a need to periodically review and update these guidelines. So we must have a definite target, whether it's annual, like we do with ADA, or it's biannual, or every 5 years. Then, we need involvement and buy-in of key stakeholders, including the Federal Ministry of Health, Association of Clinical Endocrinologists, Nigeria, Diabetes Association of Nigeria in particular, because there's also a guideline for universal acceptability. So going forward, all of us must agree together on one. Then, emergency care should emphasize continuous glucose monitoring and contemporary insulin delivery methods. We must have that must also be included. And then, I'm also recommending that we should have a chapter on insulin therapy, both in the in and outpatient setting. This is the way we can bring in general practitioners to encourage them to use this. Also, and finally, as a recommendation, we must include advocacy and working groups. It is these working groups that will be the supplier of information from their data and research on what we put as we continue to upgrade. And I think as I approach the final slide now, I must not stop this review without acknowledging the hardworking and dynamic EMSON Exco, led this time around by Professor Oloko. All members of ESCO have worked so hard to produce this document. Our industry partners, some of them have been cited, pharmacy houses, I think AstraZeneca, for contributing and helping us to produce what you have done so far. And indeed, finally, every single member of MC, I think we all deserve a round of applause. And that will be my final slide. Thank you very much.
Thank you, sir. Please, another round of applause. Sir, please don't go. Don't go. We will need you over here. So we are moving to the formal launching of the book proper. Sir, please just stand there.
Okay, sir. So we'll invite our special guest of honor, sir, to please.
All members of the high table.
Please,
all members of the high table. All fellows of EMSON. All fellows of EMSON. Please, please, please. All fellows of EMSON. And then, what is a guideline without patients living with diabetes being part of the launch? And we have one of the key speakers in IDF, and she's always pushing for advocacy for diabetes care, especially amongst people living with diabetes. I think we all know her, especially in Dan. She's looking at me, I'm looking at her. Lion Chima, please come. A round of applause for her, our top person. Please come, please come, please come. Fantastic outfit. You know there's no how we're not coming. Please join. Okay, yes. Okay, sir. So our special guest of honor will lead the launch. The book is here. So as you launch, Daddy, you will unveil the book.
Thank you. It's very clear that guidelines are imperative for most illnesses. And the guidelines should be on every table of anybody practicing endocrinology diabetes. Fortunately, these guidelines can also be in soft copy. So there is no question of, I didn't have the book. It should be on everybody's phone. We used to have, and I don't know if it's still existing, the Pan-African Diabetes Study Group. And I was president of that. I would produce a guideline like this. But you see, what you produce for as an African thing cannot be used solely for another country, because things are different generally. And even the Ministry of Health also has some guidelines in treatment. And the Diabetes Association of Nigeria also have guidelines. And it's very good for EMSON to have, so that people can compare and contrast. And we hope that the guidelines that EMSON have produced and the Diabetes Endocrinology of Nigeria fall together. For instance, for hypertension and so on, you have American Cardiac Society, the American College of Physicians, and so on and so forth producing. But you should use the one that is local to you, how to help. So having said that, I hope this is going to be produced also in soft copies for everybody to. But there is nothing like the hard copies, the original ones. And can we all? Can we all hold while we? Well, it's my pleasure to launch this book. First of all, to unveil it. That doesn't require you to pay. I don't need to pay any money for that. And then, to the glory of the people of Nigeria and to the knowledge, to improve the knowledge of our students and our fellows, I unveil this. And having done that, I'm very pleased to say that I like the feel of this book, and I don't want to be the only person liking the feel of the book. So everybody should have a feel of it by having at least one copy. And this will be, I haven't discussed with Professor Loko and his executive. Do you want Owo Jebu? Would you accept Owo Jebu? Or Owo Baba Jebu? Owo Baba Jebu. You see, in the past, people used to say Owo Jebu was counterfeit. But they didn't realize that the Jebus actually produced the best. But all these days, you just photocopy and make counterfeit. In the past, we sit down and draw it properly. So, and now, it's a crime to do so, and we don't want to go to prison. But I will launch it with an undisclosed figure. And I thank, this will be for the news. We should spread it to everywhere. And I hope the news of this will spread. I have read it. I actually wrote the foreword on it, and I strongly recommend it. I don't know, how much is the cover? We haven't decided the cover price.
We accept anything in Naira, dollars, pounds, euros.
And a Jebu.
No, we don't accept.
You see that? I'm only allowed to spend the whole Jebu. Anyway, so we'll do what we have to do. Yes. Thank you very much. And God bless you, and God bless.
Thank you very much. Thank you, everybody.
Thank you very much. Just to state that this guideline is actually in the African Journal of Endocrinology and Metabolism. It is there. Thank you.
Thank you. Please, you can take your seats. Thank you. Thank you. Small notes will be sent to you if you have anything.
No. Okay, let me use it. I'm waiting for our distinguished special guest of honor and chairman to take their seats before I make a few remarks. You all agree that we have had a great launch of the first of its kind ever, Endocrine and Metabolism Society of Nigeria Diabetes Guidelines. Please let's put our hands together once again for our distinguished high table. Clap now. Is it hypoglycemia? Okay, I had hyperglycemia, not hypo. Or euglycemia. Yeah, euglycemia. Okay, don't worry, we will take care of it in the next few minutes. So at this point in time, if you are moved to come and launch this guideline with any amount, you're welcome. We also want to use the opportunity to call our industry partners to come and launch this guideline. It's important we do this because the copies available are very limited, hard copies, I mean. And these guidelines have been produced for the wider use and benefit of all Nigerians. And EMSON, as a professional body, cannot do it all alone. We need support to be able to produce many more copies of this guideline. I was involved in a research meeting with some colleagues cutting across specialties. We were in one research group together, and the main crux of the work that we want to do has to cite guidelines in Nigeria on diabetes. And I told them we have guidelines, we have existing guidelines. Thank God I have also the privilege of being part of those guidelines, the first and second edition of the Diabetes Association of Nigeria guideline. When the day when Professor Senichine was president, I was his vice president. The Federal Ministry of Health Diabetes Guidelines, which was launched, I think, sometimes in 2018. So I said, well, we have guidelines. They told me no, that they want the one from a professional endocrine body. And I told them, just give me a few months and we'll be done. We are almost done. So now I am very happy and proud that I will go and confront those my research partners and tell them that the Endocrine and Metabolism Society of Nigeria DM guideline has already launched and it is being published. So let's put our hands together for ourselves once more. Professor Anuma passed a very vital information, and I didn't hear us clap or celebrate it. The fact that this guideline you are seeing is already available online. This is published in the African Journals of Endocrine and Metabolism. A lot of work went into the online publication of this guideline. And I say it with a huge sense of pride that all the currently existing guidelines in Nigeria, save for the one from Federal Ministry of Health, maybe, have no benefit of publication in a journal. In a journal. Not just you Google and you see this one is published in a journal. And so for those that will require appraisals for promotion in your various institutions, if you contributed to this work, it is citable. So this guideline is a citable material. For those in academics that want to do appraisal, it is a citable material if you are doing reviews of guidelines in Africa, if you are doing anything that has to do with diabetes care and you want to see what goes on in Nigeria. If you are doing an audit, you can even use this guideline to do that and say, I want to look at the effectiveness of diabetes care in Nigeria and do an audit and say from the time this guideline was developed, launched, to a given time, and you do your assessment. So its use and applicability is limitless. So please, let's accept this guideline, embrace it, and do the needful. I'll be calling pharma industries to come and do their launch. Dr. Korubu, I want pharma industries. They are outside in their exhibition. Tell them to come in. Let them come in. They have to come and launch this guideline. We need them to launch this guideline so that at least they can carry the message even faster than us. Let them come in. Sorry, sir. I will be done with this very soon. Yes, sir. We are about rounding up. So, Mega Life Sciences, we have just launched the EMSON Diabetes Guideline, the first of its kind, a unique opportunity, and the launching is ongoing. We want Mega Life Sciences to join us in the launch and tell us how many copies you want to launch for an amount, whatever it is. Okay. You are also allowed. Okay. The top hierarchy of Mega Life Sciences, they are here. And so you are allowed to launch in dollars, in pounds sterling, in euros, or in naira, whichever one. But please, you have the floor.
Sir, definitely, as you know, first let me say good morning to all ladies and gentlemen and my colleagues. This was an idea I was looking forward, and I've discussed with some of you colleagues, if you remember, sir, in the past, that Nigeria should have their own guidelines. because normally what happens, we follow what is American guidelines and some Indian guidelines. Like in India, we used to have guidelines specifically. So this is a great initiative. And sir, traditionally, as a company, we are committed towards this, towards your education and well-being of Nigerians. So definitely, whatever we can do, my senior Mr. Sandeep is also here, and my VM Ijeoma is also there. So we will definitely look into it and try to see as much as we can distribute to your colleagues down the line, wherever is our reach. We will try to look into that, sir.
Okay, thank you. Let's put our hands together for Mr. Amit. Mega Life Sciences will be seeing us in camera. Thank you very much. Thank you. Thank you. Thank you. Thank you. Pharma symbiosis. Which pharma industry is here? Where is Eunice? Eunice? Yes, please. Yeah, Kiki. Stand this way. So, this group, we are in the process of launch of the EMSON, first of its kind ever, diabetes guideline. It's your turn to launch. We accept dollars, euros, pound sterling, whichever one. So the idea is we appreciate all your support. Please, let's put our hands together for Pharma Symbiosis. In the development and writing of this guideline, they had contributed substantially in facilitating some of our meetings, and we appreciate that. But the task here right now is to launch. And I know you have put a lot of effort in it. To launch it shouldn't be much of a problem. So tell us how many copies you want to launch for how much, so that you can contribute to the dissemination of this information to Nigeria. Thank you. You can pick the microphone.
So I would like to use this opportunity to say a big thank you to the president of the society and all members of EMSON, and of course every one of our guests here. It is indeed an honor to be part of this. I was just telling somebody, I said this has been a long, time coming, and it's really something of pride that we're here today. So, luckily, I don't weigh so much, so I'm not expected to give so much, but there are other heavier human beings coming. I'm just trying to live healthy, so the bigger people are coming, and I'm sure that when they come, they will do a better launching. But I just want to see that our company, Pharma Symbiosis and Symbiotica, are very happy to have been a part of this. This is not the climax of our collaboration with EMSON. You can have that as our word. We will continue to collaborate so long as it expands patient care, improves clinical outcome. You can always count on us. So on behalf of the heavier human beings, thank you very much.
You have not... Oh, we should wait for you, right? We'll hear from you. Okay. We'll be following you. Thank you. Okay. So, who's the next company that's available?
Our next partners?
Lekam Pharma, please.
Very
please.
good. Very good.
Come on. Welcome. You can have the mic.
Thank you so much. We're grateful for this. And on behalf of Lekam International Pharmaceuticals Limited, we really appreciate this. And as a scientific company that we are glad to have this in Nigeria. And by this, we'll be launching few copies, and we will tell the amount in camera.
Yeah, this camera is getting loaded. Thank you. Thank you.
Thank you so
Just put the mic there. Thank you. I've been waiting for Noble. Where is Noble? We are rounding up. We are rounding up. Okay. They are not forthcoming, right? Huh? So the launch is ongoing. In the coming weeks, we will reach out to them and they will launch. So we'd like to thank everybody. We'd like to thank the high table. I'd like to thank all of you for your patience and your time in this very important launch. Thank you very much.
Round of applause for our president. Round of applause. Distinguished ladies and gentlemen, we are gradually winding up this session. Now is the time for closing remark by the chairman of today's occasion. Sir, I hope we are not interrupting your meeting.
As they say, all good things must come to an end. I can only close this by focusing back on the theme of this conference. One, we need to innovate to ensure that we maintain manpower in this country. And a lot has to be done by the team, by mentoring people, by training program. And last but not the least, the government itself has to respond to this by making remuneration and work conditions attractive to those in this profession. And we have to do everything to make this possible. With that, it's my pleasure, therefore, to declare this opening ceremony closed.
Thank you very much. Thank you very much. Please remember that what we are closing is just the formalities. Presentations and other events continue. At this point in time, we would like to invite Dr. Mrs. Ope Fasimade to give her vote of thanks.
Good afternoon to us all. Thank you. It's been a beautiful day so far. It's an honor to stand before you to give the vote of thanks on behalf of the Central Organizing Committee. We want to thank God first for the opportunity for us to all be here. Some of us traveled from far and near, and God has protected us and kept us till today. We thank God for giving us the strength, the courage, the spirit to organize this event. We thank God for all our speakers. We thank God for the chairman. Thank you so much, sir. You know, the last time I spoke with you, you said the Association of Reproductive and Fertility and Reproductive Health, they're also having their conference. And he's one of the main speakers for that conference, but he chose to come to chair our meeting. We thank you so much, sir, for coming. We thank our special guest, Ogbeni Oja of Ijebuland, Olorogun, Dr. Sonny Kuku. He's wearing several caps. He's the Regent Awujale of Ijebuland. Can we give him a round of applause? Despite being that, he still found time to come here, to be our special guest of honor, to be our chief launcher. Thank you so much, sir, for coming. We also thank our keynote speaker who couldn't be here physically. He had to give his keynote address online, and we thank God that it was a successful and impactful presentation. We thank God for all our teachers. Prof. Anuma, Prof. Oyenusi, our LOC chair, and everyone here. It's an honor to have you. We thank you. We thank our sponsors, the pharma companies. If not for them, will not be here. We thank God for you. Thank you for coming. And we pray that as you go back after this program, you will go back safely. And at the end of everything, we'll have cause to give God the glory. In Jesus' name, amen. Thank you all for coming.